This laser procedure is being done on a 6-year-old child on his baby first molar. The reason for the necessity of the procedure being done is a small cavity on the backside of the first molar. The uniqueness of this procedure is it's providing what they call a tunnel access, which means that all I have to do is make a small opening into the decay area, remove the decay, and then fill the tooth with a bonded resin, retaining 90% of the tooth structure. The conventional approach on this without lasers would be to remove almost a third of the back of this tooth and put a filling in the tooth. Very invasive, it loses a lot of biologic tissue. Right now what you're seeing is the laser making the access opening through the enamel of the tooth, and very soon you'll see the access being created. And you can see right there that now the black area that in front of the little laser is the decay becoming visible. But we're not making our access from the top chewing surface of the tooth. We're making it from the side, and that retains the top surface of the tooth for strength and stability. You can see the dark decay right in front of the silver tip of the laser. Every once in a while you see a little flash of light being picked up from the camera, which is actually the light that you're seeing is not the laser. The laser is invisible to the human eye, but the guiding beam for the laser itself, there's a little white light guiding beam that shows me where the actual working laser is contacting the tissue or the tooth. You're starting to see the access being expanded. Right now what I'm doing is I'm undermining the enamel, removing more and more of the decay, following the pathway of the decay as it's spread underneath the enamel of the tooth. So it's kind of the bacteria creates a little opening in the enamel and then creates a little cave where it can live. We're exposing that cave so the decay becomes visible. And as you notice, we're also seeing less and less of that black, dark brown area on the tooth. It's because more and more of the decay is being removed. So right now I'm removing the decay. Very interesting to do this on a non-sedated, wide-awake 6-year-old that doesn't have a lot of attention span. The interesting thing about this is I'm actually doing it without an assistant. So I'm holding the mirror, the suction, and the laser all by myself. Interesting. Interesting amount of contortionism here, just to do that. What you're not hearing, because you don't have any audio to the patient, is that this young man, as I'm working on him, is falling asleep. And every once in a while you'll see him start to close his mouth as he starts to slip into a deeper phase of sleep. I didn't give him any sedation. In fact, it's very minimal anesthetic. But he's just like any other kid in one place, not doing anything. He's kind of bored and drifting off to sleep. We're actually doing this at about 2 o'clock in the afternoon, so you see he's going to sleep on me. I can't even get my fingers in there. The reason I videotaped this procedure is actually being videotaped from a camera that's mounted on my headset, my magnification optics that I wear when I'm doing laser procedures. But this is actually, you're seeing this under about, I think it's 2 power magnification from the camera itself. It's a surgical camera. In fact, the camera that I use has also been used to videotape NOVA type educational slots. It's a very good camera. Nice thing about it is I don't have to think about aiming it, and I don't have to think about special lighting conditions. So it videotapes exactly what I see, where I'm looking. So it's not wandering around the room. You can see me drying the cavity preparation right now. I'm applying the etchant, which cleans the surface of the tooth to provide a bonding surface for the composite bonded resin that I'm going to apply. There I'm applying the bonding material into the cavity. You saw me putting in the thin plastic material between the teeth. That's just to keep the teeth from being adhered to each other and being glued together by the bonding material. There I'm rinsing the bonding material off after setting it, just because keeping a clean field. Drying the tooth structure off, drying desiccating material, applied the adhesive, now setting the adhesive for the bonding. Applying a flow composite material into the preparation to block out and fill any air voids so there's no microscopic voids in the material. Applying the body bonding material into the cavity. Trying to keep my fingers from being bitten as he falls asleep. Having fun that afternoon. Interesting enough, it was very challenging to work on a 6-year-old that kept falling asleep by herself without a dental assistant. Dental assistants make my life a lot easier. They add a lot of, make my procedures go a lot smoother. Carving off the excess bonding material before I set it. Setting the bonding material with the light, cure. When the light goes off, the material will be set. It'll be as hard as it's going to get. The only thing left to do then will be polish it. Removing my separation from the two teeth, using a high-speed polishing burr to polish off the excess flash from the tooth structure. By far, I'm probably seeing something that you can't even see with the camera because I'm looking at it with about 8 power magnification, and the camera's seeing it at about 2. So when I'm polishing, you probably can't even see in this video. And this young man had no prior acting experience. He's doing a great job. Okay, we're rinsing it off. Took out the cotton rolls. And we're done. Checking it with dental floss, making sure it's smooth. Making sure that he can maintain his hygiene. And just as a practice, I like to set it one more time. Even though this may not be necessary, overkill can never hurt. And you can see the final restoration. There it is. Can't see it. Can't find it. Looks like the tooth is all one piece again. And one happy camper when we're all said and done. And boy, was he happy.